Good afternoon. I'm Dr. Sarah Smucker-Barnwell, and I'm a member of the Trust Board of Trustees. I'm glad that you're able to join us today for our 26th Telehealth Community Chat. As a trust policy holder, we hope you're familiar with our telehealth community chats. I'm pleased to once again be joined by Dr. Margot Adams-Larson. In the interest of time, our bios have been placed on the slide for you if you want to check them out at a later time. So without further ado, let's get started. Hi, Margot. It's a pleasure to see you today. And yeah, always a great time to get to connect with you on these quarterly chats.
So great to be here. And as we're getting started, we're kind of changing things up a little bit today. So I just want to orient folks to that. This is our quarterly check-in. As usual, we've pulled content from our past questions that we didn't get to or we wanted to take a deeper dive into. We also pulled some questions out of emails and some of the evaluations. And the content we have is on the agenda slide today that you will have access to, and you can move us over to, Sarah, as you're guiding the slides in our new trial of having some slides as we go through our chat today. We've had folks ask for that, and so we're going to test it out and see how it goes and let us know.
Let us know how
You
you like
can,
it.
yeah. Also, as Sarah mentioned, you can drop your questions in the Q&A or you can email them to telehealthcommunity@trustinsurance.com. And we've got some bullets that we'll be covering as we go through our slides today. So you can play along and follow along that way. And you'll also have access to these. I believe they came out in an email and that they'll be dropped in the chat, a link for those as well. So to kick us off, Sarah, I know we've got a few newsy items, so I'll toss it back over to you to let us know what's new in 2025.
Absolutely. So here's our agenda. So we'll be starting off with some news, and then we're going to try to get to some of those items from last session and hopefully answer some live questions today as well. So without further ado, let's talk about the news. What's been in the news? The nice thing about telehealth is it never wants for things that happen for these quarterly updates in the prior 3 months. I wanted to start off talking today about the CMS or Center for Medicare Service coverage for the calendar year of 2025. In late 2024, this organization, which oversees, billing codes and what's reimbursed for Medicare patients, they updated what would be covered for telehealth in 2025. Now, some of us may see clients who see us through Medicare, some may not, but the reason it's relevant for everyone is as Medicare goes, typically so goes private insurance, so goes the trend in telehealth. So when we see changes in Medicare, they're really interesting for the entire profession because they tend to have far-reaching implications. And what we saw was as they were finalizing these healthcare common procedure codes, is that they made allowances expanding what was going to be covered for telehealth. And it's really great news. Particularly, they offered some coverage of digital therapeutic products as well as related treatment management services to be covered through Medicare. What's a digital therapeutic? This is like the thing I love to talk about because often people say digital therapeutics when they mean mobile apps or when they mean, helpful websites. But digital therapeutics actually has a really specific definition. These are patient-facing software applications that help patients manage symptoms, improve their quality of life. They are evidence-based. And validated through research. And indeed, we're seeing a trend where the FDA has even approved certain digital therapeutics for the helpful sort of diagnosis and management of specific conditions. For example, there are several related to diabetes, there are several related to addictions that have FDA approval. So, with this new coding, it's really kind of a validation and expansion of what we can expect to see. For me, it's a helpful way to understand, well, what types of products really have been demonstrated in evidence? And, when a body like the FDA approves something, that to me is kind of an extra layer of validation. When it's being accepted by Medicare, that's an extra layer of validation. It helps me discern what quality is in a really broad marketplace. Additionally, we saw that they're going to be adding services for telehealth for the training of caregivers. So people who are caregivers to someone who requires some type of medical service, medical care. Now, training that caregiver can be covered via telehealth covered by Medicare for telehealth, which is another way to really helps expand care to patients. So imagine you have a caregiver delivering care into someone's home. The ability to get that training over telehealth is a really incredibly important win. And in ongoing ways, we see a delay of the requirement for an in-person visit for patients receiving telemental health treatments in their home when they're in a rural community. And we see continued access to audio-only telehealth in situations where practitioners could use video, but for whatever reason, it's just not a good fit. So again, these are really great trends in terms of the validation of telehealth and in terms of just the continuing indication that telehealth is here to stay. Along those same lines, in September, APA published an amalgam of data from the Practitioner Pulse Survey, among others, finding that the majority of psychologists are currently using, continue to intend to use in the future, telehealth. And it was, in fact, more than 3/4 of people surveyed. So more than 3/4 of psychologists surveyed through their Practitioner Pulse Survey, a very large data set, indicated that not only is a substantial portion of their practice telehealth, they have no intention to transition that out. Not surprisingly, there's some variation by career stage, with earlier career psychologists tending to have a larger percentage, is my understanding. I think this is interesting. A, just continues to demonstrate the strength of the modality, but B, in other areas post-COVID or post-COVID era, we have seen reduction in telehealth adoption. So in other sort of telehealth disciplines, but not in mental health. In mental health, it continues to be, pretty strong trajectory. So those are my newsy items, Margot. I know you have one as well.
Fantastic. Yes. Well, it kind of continues that same string of information in terms of we're here to stay. The SIPAC has been inactive and is in effect in 42 states. And so we've seen quite a massive uptaking for many folks in jurisdictions now, with the trend for being able to utilize the SIPAC as a means of providing telemental health services in other jurisdictions. Montana now has, pre-filed for this upcoming legislative session. And you can find more about what jurisdictions and more about the SIPAC on some of the links that we'll be providing and dropping in from the slide deck. But the SIPAC is run through the ASPPB organization, and they have some oversight of that. So you can find links for all this information, and we'll be dropping those in the chat as we go. I think it really just shows the energy and momentum that we've had over the past several years, and the I think comfort that we're seeing with some of our colleagues in terms of wanting to continue to offer services through this mechanism and method. So I will toss it back over to you, Sarah, because I think very importantly, understanding our fitness to practice telehealth is a key component to having a success in continuing to practice in this manner.
Absolutely. This is a question we get almost every chat, almost each of our 26 chats. We've had the question, what do I need to do for it to be appropriate for me to do telepsychology? And, I think the intention of the question varies, and I really understand where this question comes from, this idea of fitness to practice, because telepsychology is this massive umbrella. Recall that telepsychology is defined by any digitally enabled service delivered by a psychologist. That's a vast diversity of services. And we do not have a formal credentialing process. And what I mean by that is we have psychology licensure, and to be a practicing psychologist, we need our license. But provided that you are practicing within your jurisdiction appropriately and within your competencies, there is not a separate provision specific to telepsychology. Again, we have SIPAC that enables us going between jurisdictions. But when it just comes to the concept that you are fit to provide telepsychology, we do not have this other formal credentialing process. I think, for example, a specialty area like neuropsychology, we have mechanisms to kind of gatekeep and validate and signal the needed levels of competence to practice in that area. I did a rotation and clinical internship for neuropsychology. I loved it. I had wonderful instructors. I'm probably would be very inappropriate next week for me to hang out my shingle and say, you know what, I think I'm a neuropsychologist. I'm just really feeling like one. No, like, most typically I would attend postdoctoral training. I would certainly attend a tremendous amount of CE. I would have additional instruction that made sure that my competencies were where they needed to be to do that. And we don't necessarily have an analog. We don't have an ABEP or another mechanism for telepsychology specifically. So given that there is not this special facet to licensure, I think a lot of psychologists are left wondering, like, well, how do I pursue those competencies? Some jurisdictional boards do offer guidance regarding how to do specific types of telepsychology, most often video conferencing or telephone. We'll see that individual boards may opine. We have our telepsychology guidelines from APA. The newest revision just came in August. But I think there's still this idea of, how do I ensure that I'm doing this ethically and appropriately? And of course, all of us are required to ensure that we practice where we are licensed, we practice where we're permitted, we practice when and where we're competent. But it does make this question of telehealth fitness confusing. So I really do understand where the question comes from. So, but for me, it really comes back to this idea of remaining within my competencies. I'm a psychologist, I'm not a technologist. Earlier career psychologists may have options for more formal classroom training or practical instruction. Many programs do have this as part of their training increasingly. There are pre-doctoral internship rotations now in telepsychology that offer training for our trainees, and postdoctoral fellowships in telepsychology are available, typically for psychologists who want to have a career in telehealth policy or administration. But how do I, as an independent practitioner, out there in the world, think about promoting my own competence and how do I access it? So I think, for me, this is it's a great question because it's a really big umbrella. So there's a lot of guidance in the literature, and I like to think about telepsychology as a series of competencies. And indeed, we talk about this a great deal in the newest guidelines. In the new telepsychology guidelines, we break down our competencies into four sort of subcategories. It's not a single objective, but a series of skills is kind of the way we can think about it. There's content competencies. So what services am I providing? Am I using the right tools? Am I adapting the service appropriately? So if I am a talk therapist, in some ways I may have an easier course of it than if I'm a neuropsychologist who does, highly sensitive and specific testing. I need to think about what is the service I deliver? How is that adapted? There are the technical competencies. Do I understand the technology that I'm using to facilitate telepsychology? Can I instruct my clients and patients appropriately? Am I able to make that transition from the technical side of things, understanding what's needed? Do I have the right equipment? What am I going to do if there's a problem? How am I going to troubleshoot issues? Those types of themes. And then there's population competencies. So now I have these tools vis-a-vis telepsychology where I can reach all sorts of new people. And that is at the heart of telepsychology. Telepsychology is about getting high quality psychological care to those who might not be able to access it otherwise. But do I have the necessary competencies to serve the people I can reach through telepsychology? One of the greatest applications I've seen are opportunities to serve gerontological communities to make sure that we are getting folks with that specialized training. Again, I may really believe in that mission and I want to do that work. It doesn't mean tomorrow I can hang out my shingle and say, well, no, I'm a gerontological psychologist. I might not have that competency. I might not have that training. So I need to make sure that as part of this transition to using these tools, I'm thoughtful about who I'll be serving and making sure that I serve them really well. And I think all of this comes down to the fourth area, lifelong learning. The idea this isn't a one and done. It's not like, well, I took my telepsychology CE and so now that's it. I think it's always the case as psychologists, we're committing to maintaining our competencies as science evolves, as practice evolves. This is especially true in telehealth because this is a field that changes pretty darn rapidly along with technology. I mean, the good news is we're all here today talking about telehealth, so I think we're evidencing that commitment. We're showing up. And increasingly, we see a great number of continuing education opportunities and even certificate programs in telepsychology. The trust offers our telecompetencies. Let's try that again. Our telepsychology competencies credential, which is a series of courses that kind of hit those fundamentals. I think there's always balance to be had here in CE. So I think CE and thoughtfully designed postgraduate education is the cornerstone of maintaining our competencies. It's also a vast marketplace with money to be made. A lot of programs pop up that I see. And so for me, I think it's kind of figuring out to what extent will I feel better supported by a program that is thoughtfully designed, walking me through a series of instructions? Or to what extent do I feel confident in my core competence and I just need to supplement or augment a little bit? I think I wanted to put in a few in the chat. We'll see a couple of resources that are free resources through the Department of Health and Human Services and through the Telehealth Technology Training Centers. So there are some free resources if we want to augment. I really like the Trust product that kind of walks us through those core competencies. I mean, whatever the case, this is all to drive home the message that fitness for telepsychology, like any area of psychological practice, requires us to understand what we intend to do, how we intend to do it, who we intend to serve, and the tools we're going to use to do this. So we're sort of committing ourselves to maintaining those competencies, continuing education, whether through a program, whether through self-designed instruction, whatever the case, it's lifelong learning. And I want to put a plug in here. I think this is really fun. So for me, like the prospect of lifelong learning in telepsychology, of understanding what's next, how am I going to use it to serve clients? Should I use it to serve clients? These are the types of things that brought me to the field of psychology, understanding the science, its innovation, and how it can help people, as well as the ethical mandate to do that thoughtfully and well, kind of gets to the cornerstone of what I think is amazing about the work that we do. So, okay, I've been talking a lot, Margo. I'm going to pause here because I know we have a lot to get to today, but great question, fitness for telepsychology. And the general upshot I hope folks take away is, knowing sort of what we're going to do, how we're going to do it, and seeking the appropriate CE that will support us.
And I think that's such a great consideration and overview for a lot of things that we would be thinking about doing as a clinician in general to understand those four core components of whether it's telepsychology or neuropsychology. They're the same core components of understanding our readiness for that. And I would maybe just add in that just because all of those things are available doesn't mean you have to feel compelled to do that either. That you have choices in this of who you're serving and when you're engaging in this. So always great to think through these considerations and have some conversations with your colleagues as well to get a sense of kind of where that really lies for you and your enthusiasm for this. I know a lot of us were kind of thrust into telepractice worlds. And I know I've had some conversations of folks thinking this is great for some reasons, and maybe, time to balance out some things for some other reasons of, seeing people in real life. So
I like to
thank you
say
for
the
that.
accidental telepsychologist.
Exactly, exactly. We have a couple interesting questions that are coming in. So I'm going to kind of just jump into some of those for us today, Sarah, and then we can kind of see what else we have going on. There's one question about how long is the phone telehealth extended to be covered? And I know we've had these questions from time to time in terms of the coverage that the government grants. So I thought I'd pose that over to you again to see if they gave us any timelines or if we're just waiting for the next appropriation period.
It's a great question. Forgive me. I am happy to look up the precise date. It is until the next CMS revision. So typically, historically, I believe those happen at least twice annually. So at minimum, I would anticipate 6 months. My instinct would be at least a year. Many people, excuse me, let me take a step back and say what I read in the blogs, what I hear from people generally is that we can expect this indefinitely, that there is no appetite to take this away, that broadly the way the water is flowing that is that we can expect continued coverage of audio only services. Its guarantee is a separate question. And so I would certainly move with confidence for 6 months. I think a year, and I'm happy to look up that distinction in the fine print, is a reasonable estimation. And most people, I think, believe that we're going to see this indefinitely. So it's not something that I would have anxiety about, though it is a worthy thing to be checking on.
And similar to most other legal kind of considerations in practice, we should be always kind of checking in a couple times a year in terms of what's been authorized, what is happening in our insurance third-party coverage worlds, how things change sometimes at the beginning of the year, sometimes throughout the year, and laws are changing all the time. And so making sure that it's something you're not kind of just stamping as, yep, we're good to go forever, but checking back is always a great
Yeah.
idea.
And it's, I think you raise an important point, which is just because CMS says it, we know that's the case for Medicare. Private insurance is not beholden. So it is my understanding it's going to be through the calendar year, since I'm thinking about the provision is called calendar year 2025. So one would suggest from the title, it's for calendar year 2025. So, I think we can expect it through calendar year 2025 for Medicare. There is very little that prohibits private insurance from making a different determination. It's unusual, and again, my sense is that there is very low appetite to endanger those audio only services. They've been wildly popular. There's a lot written and talked about with regard to ableism, the notion that video makes it, a more valid mechanism, is encountered, I think, rightly as ableist towards sighted people. So there are some issues there that I would be very surprised if we saw a reversal.
And kind of in a similar follow-up question, we have a question in the Q&A about Medicare requirements for the periodic in-person sessions, and if there's any information or
Mhm.
content we have related to those
Again,
requirements.
I would check out this CMS, the CMS calendar year 2025 ruling that they just published in late 2024 on their website. But my best understanding is that they have, again, for this year, for clients in rural areas, and they have to be federally designated rural areas, is that they have facilitated the continued delay of that, first person meeting for mental health. So to be clear, then that's specific to psychology. I believe psychiatry has its own set of provisions.
Fantastic. A lot of the links that will be available if you have the slide deck will also help you find more content and information on this as well. So, Sarah, we have another question that's one of the jurisdictional practice questions that's fairly common, and I won't read the whole question, but the summary is, for two jurisdictions that are not participating as part of SIPAC, and we know there's very few of those now, but we have a licensee in one of these non-participating jurisdictions with a client moving to a different non-participating jurisdiction, and receiving some state confirmations that they would be allowed to receive services up to 12 sessions per
Mhm.
year. And questions asking if we would encourage or discourage this. And I'm curious what you think on this.
Sure. I mean, there were some really great points of information in the question. This is an anticipated move. So it's not an emergent circumstance like, oh my gosh, I'm in this state and there's no side pack, but I'm having an emergency. Because I feel like that's a bit different. This is a situation that we know it's coming. We're making plans in advance. We're not responding to emergent circumstances. Our choices are being duly licensed. If you had a robust practice in both locations, my first recommendation would always be just go get the license. It's just going to save you hassle in the long run to have a license in both places. It's additional expense and hassle and CEs, certainly. But if that was a regular part of your practice, that would probably be the most practical. If it's one patient moving temporarily, then, it sounds like this person did just the right thing, which is you look into the board's policy in the location that the patient will be, see if they have a provision regarding permitting temporary practice. I encourage you to contact your home board as well to see, to explain the circumstance, because that's a piece that often gets overlooked. It's rare that there's prohibitive language there, but it is the type of thing you want to double check. Double check the distant board, the patient's board. You want to check the board where you are seated when you practice. Assuming you are in your home jurisdiction, which is always a good idea. Then additionally, I would always make a call if you are a trust policy holder, calling the advocate, the risk management service, just walk through any issues. Because again, you want to be cognizant of what are the different rules, whether it's reporting requirements, whether it's privacy treatment, ages of consent, those types of things. You want to understand the difference in advance to, starting that care and have a plan regarding how you're going to negotiate them. Make sure you capture that additional informed consent documentation. Make sure you update your emergency plan to be thoughtful, not only of the distance, but additionally of any conflicts in the laws between the two jurisdictions, and then really make sure you're sticking to whatever the provisions are for the number of sessions permitted. Always a question is when I've had this circumstance, and I've had it as well, is what's the plan? Because it's like, because what happens is clients move and they don't want to leave you because they have a nice clinical relationship with you. And I absolutely understand that. And my first priority is serving my clients always. Um, and if I'm only permitted 6 sessions, 10 sessions, and I know we're going to use them up pretty quickly, well, what's my plan? So, that's the type of situation where I would have a goal of not using the total number if I think they're going to stay there. Now, if they were going on temporary work assignment and they're coming back, that's a different situation. But if there was just, nope, they're just moving and that's where they'll be, and I have no intention of getting permanently licensed there, then I would probably be using those sessions to help transition care. What, Margot,
Well, I
anything
love
you
how
add
you,
to all that? Yeah, sorry.
yeah, I love how you ended into the segue for the clinical considerations of this, because I think this is one of these questions that we have a lot of interjurisdictional consideration for, but maybe thinking about understanding what the value clinically is for utilizing those care sessions. And it made me wonder as well in terms of if this is an insurance covered patient or client, if there's another factor to look into related to insurance coverage for the services that might be provided in an interjurisdictional manner in that
Great point.
way. So there's a lot of places to check, and probably a great segue to our next session or section. And I think we have some bullet points on this. From follow-up from some questions from last time related to how to find the laws in various jurisdictions. And I think, we initially think, oh, can we practice or is telepractice acceptable? But there's a few other things that we want to understand and know about in those other jurisdictions in terms of duty to warn, in terms of related reporting laws, and age of consent, as you just mentioned, Sarah. And, we have oftentimes, I think, quickly reviewed, just the basic practice laws, but don't dig deeper into some of these other considerations that we really need to know about before helping others in other jurisdictions. So following the process for figuring out where do you learn all this or read about it for your own jurisdiction is the first place I'd start. Knowing where to find the duty to warn or reporting laws or mandated reporting, elder abuse kinds of laws. They're sometimes scattered throughout all sorts of different laws within your jurisdiction and don't always fall within the psychology practice law. Sometimes they're referenced, sometimes not. So it can be a bit of a scavenger hunt to figure out where to find these things. Certainly, it can also be a scavenger hunt to figure out where to find the consent, age of consent for different services, and or even if you're looking into, somebody who might need to have hospitalization and how to access that and what the process is. So searching your own jurisdiction, figuring out where to find that within your own laws is a first step. The next thing I would say is to look to that other jurisdiction that your patient may be in or that you're practicing into. There's a handy link for the ASPPB.net page that provides the board contact for all the jurisdictions. doesn't mean that you're necessarily going to be able to have some great communication with that board, but it should at least link you to their website. And that's a great place to start in other jurisdictions that you're unfamiliar with as to where to at least find the practice laws. Oftentimes, those websites will link you out to the mandated reporting laws, to duty to warn, telepractice, and other laws that are relevant to the practice of psychology, but may not be located within the Practice Act itself. If there isn't one, another location to go to is that jurisdiction's government website and type in the search bar for laws and rules. And often then you can layer down and type another search for what area of law that you're looking for. Um, it's important to understand that the practice laws for psychology and the practice rules are not the only place that these laws hang out. And as I mentioned earlier, legislation changes continually. Every 6 months is a great benchmark to go in and look for new things. If you're kind of a legislative geek, sometimes folks are following that real intensely, and the Psychology Association in that jurisdiction may have also a website that can link you to some of that information. Or if you're going to have an ongoing practice in that jurisdiction, joining the Psychology Association in that jurisdiction may help get you more of that connection to information. Um, Finding some of these laws may be also within the occupations and professions laws of the jurisdiction. And finally, the last recommendation I would make is to look to contacting the licensing board office in that other jurisdiction to see if it's not listed on their website, if they're able to email you back, or they might know if you're able to connect with them over the phone, where you might find some of these laws. Again, that's probably the last resort. I'd look to colleagues in those other jurisdictions, but certainly it's not as simple as just kind of clicking on one place to get all this information. You really have to take some time, set it aside, and do some due diligence and go on that scavenger hunt for where to find these things. And they can be quite enlightening, I will say, as I have discovered in looking for some of these things as well. So hopefully that gives you some ideas of how to go about finding the information that we talk a bit about. And yeah, Sarah, anything that you would add on that?
I mean, I think these are all great points. The only other thing I would mention, and this was something, it's a little, I feel like this shows my age a bit in terms of, making partnerships with appropriate referral resources who would specifically benefit from telehealth. And I was going to say pounding the pavement. I guess showing up physically these days is not the way to go, said the woman hosting a telehealth webinar. But the notion, for example, when I was beginning my practice, I work a fair bit with women. I work with postpartum women. And so I reached out to my area OBGYN practices and said, hey, I have a telehealth practice. I work with new mothers. This is a great way to serve our clients and so forth. Can I send you some cards? I don't know that it was like, the biggest boon to the business, but I do think it helped market to the specific populations that I was most, I felt confident to work with at that time and that I thought could benefit from the service.
All right. Sarah, we've had questions throughout our past, I was going to say episodes, but chats.
Yeah.
And one of them was about the kind of equipment, like the technology equipment that both you and I utilize in providing the chats, but also providing our telepractice services. And so
Mhm.
I I went on the what am I using just to kind of come across and be seen on your screen, Avenue. And I know you dug in a little deeper, but I have a MacBook Pro that really is the engine behind everything that I do in my office setting. I have a Snowball Blue microphone that I have had for quite some time and seems to be doing a great job of picking things up. And I have a little Nexi Go camera that is what connects me visually to all of you. And it does have a light on it. This one isn't plugged in, but it has a variety of lights that can be used if you would like. I utilize Zoom most of the time on these chats, and I utilize Simple Practice for my clinical work. And so those tend to be my go-to items. For those of you wondering, sometimes the placement of these items is key. I have a window behind the camera today it's snowing, so it's got some great light coming in and not the sun that's sometimes I have to close the curtain because it's too bright. But I don't have these things right in front of me. They're just kind of farther away on the desk and seem to do a good job. So it doesn't have to be highly technical from where I am running my sessions. How about for you, Sarah?
I love this question. I thought this was really fun. And forgive me, I was having a slide snafu to find our correct slide. Okay, so like you, there's some products in common, and then I wanted to throw in some ones that I don't think I've ever shared in a CE context, but are incredibly helpful. So like you, I have my video conferencing software that I use. I tend to like to have two monitors. I actually don't have it today because I have all these other things I want to show you on my desk. But having two monitors is a nice option if you have the real estate on your desk because it allows you to see your client, but to have a separate monitor to look at documents, to look at charts, to look at other information that's really, really useful. I like to use an external microphone at times. I have a big one that looks like Bing Crosby, so you can feel like a crooner from the 1950s. I must admit, my teenager stole mine recently. So today I have this really cute one that looks like a little penguin, but it's an external monitor that is Bluetooth enabled, and I think ensures a richer, better audio quality than just using my integrated microphone. I do tend to like my integrated camera. This is something that people feel different kinds of ways about. The challenge with your integrated cameras is it often rides high, and so you can look to have a downcast gaze. They make other ones that will actually drip down into the middle of the monitor, so you're a little bit more head on. I probably have 5 different kinds in the closet. I just tend to like the integrated ones, but everyone's a little bit different. Let's see. I like to use a ring light, and I wanted to show you all what it looks like. So I have this snazzy fellow who helps us to look nice, and it just makes the quality of your video a little bit better, a little bit nicer. Um, and then there are some items that I use that I don't think are particularly technical, but I have to say make my life a better place as a telepsychologist. I have a little tripod stand that I use for either my light, or I can put, if I needed a backup camera like my mobile device, it seats on here nicely and sits on my desk. I have a fancy pillow that helps my back that I can sit on because I end up sitting a lot as a telepsychologist. They say sitting is the new smoking. It can be bad for your back. So I think having like good lumbar support, having a good chair, it's not fancy, but it does make my professional life better. I have a little foot support under my desk that I put my feet on. Again, these are type of specialist equipment that if you're seated at the desk quite a bit can be really, really helpful. I always have a water bottle because I no longer get up and walk past a literal water cooler, which I used to in my old physical office. And then finally, and I really contemplated whether or not putting this on my list, but I actually feel this is valuable information. I have lip balm. I tend to wear cosmetics when I do telehealth. I tend to put on lip balm. I know it's a little bit surface, but at the end of the day, you show up a little better on the video. So those are all of my
Uh,
items.
I love it. And you've reminded me of one that I didn't put on my list, which I am standing at. I have a standing flexi desk that
Yes.
goes up and down. And I I don't have a foot pad or rest like you do, but I try and alternate between a standing appointment and a sitting appointment so that I can at least be moving a little bit. I have some colleagues who have walking desks, and I gotta say, I get a little nauseous watching them as we're in meetings and they're walking. I would not recommend that in a patient setting or session, but it's certainly something that you might want to consider if you're doing a lot of paperwork on a day as well. So
I
thank
love it.
you for adding those in. We had another quick question that I'll touch on before we move to our last slide. And this one is about some of the recommendations that we make about seeking legal consultation or accounting consultation, in that they're really expensive, and many of us can't afford the legal accounting and consultants that we speak about. And what are we to do about that? And I wanted to touch on this because it's certainly heartfelt. I understand that those price tags can sometimes seem a lot, but there is a cost to doing business, and there's a cost to not investing in folks that understand and know how to do accounting, that understand the legal aspects and ramifications for what you might be venturing into, either within a business side or within um, a clinical practice side. And so certainly a really important consideration. And as we note, the risk managers are on the other end of the line that you can schedule calls with to get some sound legal counsel, but they can't be your specific attorney, and they may be referring you to seek other advice or seek that counsel. And there's never a proxy for keeping good documentation. And so, in any of the things that you're seeking, whether it's how you did something in an accounting manner or how you managed a circumstance, remembering to write things down at the time can be certainly helpful to help walking yourself back through those things, but also making it quicker and more efficient when you do have consultation time with a professional. Connecting with your colleagues, your state or trade association can also potentially give you some access to collective options for some of these kinds of services. And I think overall, the biggest thing I'd say is making sure your business administration or business plan for how you're managing your practice incorporates a budget for some of these items, because they will come up no matter how you navigate your business life. There is going to be a time you are going to need to seek some of this information from somebody who really has a good grasp of what's going on. And you could spend a lot of time learning about it and not making money, or you could spend an efficient time seeking that service from somebody whose expertise that is and still be making a bit of money instead of the learning time. So that's one of the kind of mindset tools I use in thinking about this. Um, Ultimately, one of my soapboxes is about how in our graduate programs and our training programs, we really get very little foundation in terms of the business management or business administration of practice. We get a lot on theory, we get a lot on clinical, we get a lot on understanding the profession itself, but not the business of practice. And this is something that is certainly growing. I know, Sarah, you've got a new program that has come out through the trust to really help us have more successful practice and understanding of these topics. And it really is key as business owners or practice owners to take a little time and learn about how you can leverage some of those other professionals to really help you out, so you don't feel like you have to do it all or know it all. You do have to be responsible for it all, but leveraging that with others whose job it is to do that can be so much more efficient. So I'll get off my soapbox on that. Anything you'd want to add, sir?
That's a great point. And for me, when I left the work of being a hospital-based practice to an independent practitioner, really wrapping my mind around being a small business owner was a shift. And when I think about working with an attorney in particular, um, for me, this is, as you say, like it's a cost of doing business. So now I have an attorney, I have an accountant, I have a consultant that I talk with about like certain themes related to technology. And I tend to schedule like an annual review with these folks. They're expensive, right? So I'm not running to them every time I have a question because that would be prohibitive. Now, if I had a really big, scary question, I would certainly call them. But as a matter of course, I try to schedule a regular review that works for my business and the rate of change, which things occur. So for me at this point, things are pretty darn steady. So once a year seems about right. If I was going through a big transition of some kind, we would see we'd see each other a little more, those consultants and I. And Margot, you mentioned that the trust is beginning a new webinar series related to the business of practice, which we just did one about a week ago. And we'll see some other great speakers coming up in the year there to help, I think, folks, as you say, wrap your mind around, both these facets of how to be successful, all the training that we receive as clinicians and ethicists and researchers, but additionally, as business owners.
And I love what you just emphasized there of finding folks that you can get to know and have some ongoing relationship with, because that certainly adds to some of the efficiency. You don't have to start over and explain where you're coming from and what your practice is. But it also helps you have more comfort in what that advice is or what those recommendations are that you're gaining as well. So, um, I appreciate that. Shall we turn into the last of our objective bullets today and talk a bit about marketing for your telehealth practice? And we get a number of varied questions in this area. Are there guidelines? How do we, what do we need to be on the lookout for? And we also get questions that kind of follow in. How do we deal with things when we're not the ones who are in the marketing, pilot seat of how this is going and how to kind of follow up with that. So I wanted to just first off mention there may be jurisdictional guidelines that you might find in your own practice law and wherever else you might be marketing into. You want to look at the other jurisdiction practice guidelines if that happens to be the case for you. There are certainly some ethos that you can gather from the new telepractice guidelines that have come out in terms of just understanding what can you say, how can this go, and what are maybe some good benchmarks to consider. But first start with those laws and then start with your colleagues in your area. And really, the idea here is thinking about the legal and ethical considerations of what you want to put out there and where you want to put that out. In the olden days, I can't believe I just said that, but we had yellow pages, which were books of phone numbers and ads that went along with the phone numbers for our practice. Now we have websites, and the yellow pages were accessible by people in the area where you worked and lived. Your website is accessible by anyone on the internet. And this creates a bit of a challenge because inadvertently, someone might find you from some other jurisdiction, some other location, and be connecting with you because of maybe something you do that's a specialty of your practice. And understanding that how you market and what you say and what you put out in the world is key to what you have to offer and who you are able to serve. And making sure that you are identifying those things can be quite helpful, can reduce a lot of frustration on everyone's part if you're not able to help someone because they don't live in your jurisdiction and you don't practice into theirs, as one example. there's a whole other layer of media marketing now in social media. And, there's the LinkedIn that you might have connected to um, your business. There's perhaps your own LinkedIn that you might have as kind of your professional side. There's Facebook, there's Instagram, there's all sorts of other avenues in social media, and navigating if you are going to professionally market in these areas, how you might be doing that, what you might be saying, how frequently you might be interacting with the content you're putting out there, as well as comments, likes, friends, connections that might be coming back into that realm for you. And we still are working on navigating the ethical boundaries of what happens if my client, friends me. And navigating what your social media policy is or your online presence policy is going to be really key to kind of filter that back into your policies and procedures. I'm really trying to focus more today on the marketing side, meaning what you are putting out there and what you are um, providing as information either for your practice or your business of practice. Um, Marketing can also come through avenues where you might be posting into a group. Hey, I am licensed in all these jurisdictions to do, telepractice for X, Y, and Z. And, if you actually have license certificates from all those jurisdictions, that's one thing. If you're in SIPAC, that's not the way to market it. You have to be cautious about the things that you are sharing within groups, even professionally. And I think the last piece I'd say on this is really thinking through carefully. Um, when you are involved as a practitioner or a clinician for a corporate provider of services, so maybe it's a corporate telehealth provider or local but corporate health system that you might be working for, it's still ultimately your responsibility of how you are marketed as a licensed provider. And ensuring and taking steps to ensure that that is ethically and legally kind of marketed out in the world is really key. And so understanding who's doing that, if it's the publicity department within that corporation, knowing what the copy is that's going to be going out to the world, knowing how that might be navigated or what the processes are is really key. And I think oftentimes there may be things that a corporation might say about what you do or how you do it, or the level to which you are engaging with patients that you want to make sure is aligned and comfortable to what your practice and what your professional ethical boundaries are related to that. So I will kind of end on that note. I think I covered everything. I'm looking over here because now my slide deck is covered up with the Q&A, but I think I've covered everything that I wanted to make sure to talk a bit about. Maybe the last thing that I didn't cover was the unsolicited comments. And, when you're not asking um, for those ratings that appear, or Google, if you have a Google listing, kind of requires you to have that available for people to give you feedback, and they don't always understand the ethics of not revealing themselves as one of your patients or dissatisfied customers, that probably isn't necessarily how things went down. There's a lot that can be up there on the Google world that is really a challenge to undertake in trying to figure out how to respond to it. And so I would often suggest that you're Googling what is marketing and available out in the world about your practice and your professional presence. And if you're finding something concerning, it's always great to call into the advocates to kind of get a little bit more detail in terms of how to navigate or what might be able to be done about some of the things that might appear. Anything
Great.
you'd add, Sarah?
No, I think you covered it really nicely. I mean, and I think I really appreciate the manner in which we're highlighting how to walk that line, especially with social media presence and some of these online milieu in which we can advertise services. Increasingly, that is the expectation, particularly for newer practices. And it requires a higher level of diligence and consideration because these are forums not built for the types of concerns and considerations we have. So I'm cognizant of our time, Margo. I'm wondering if we could sneak in one last question before we kind of get to our final housekeeping bits.
I would love that. What do you got?
Well, why don't we look to our Q&A and see what questions came in?
All right. We've had a few comments that have come in about some of the congressional reviews. So I think we've answered that as we've gone along. And I think one individual indicated a state bar association would also be helpful to, and I think that related to when we were talking about where to find some of the laws. And I appreciate that. Hopefully the Law Association would be able to give some guidance and a great suggestion. And one question to highlight back to, I've heard about the requirement for having at least one in-person appointment during the year. Is that different state to state or a national requirement?
It's a great question, and the answer it has everything to do with who's paying. So
Ah,
that relates to a Medicare requirement typically. And that is the thing that's been contested, that if you're in a highly rural area, they have been delaying that. They've been saying within the first 6 months, or they've been pushing it out even farther. And so if it's a Medicare client, you are much more likely to have that requirement. Other private insurance, I've heard various things, but for the most part, that's a less common requirement for private insurance. I've heard it happen, but more often than not, you don't see that type of requirement in those other private insurance programs. Um, in terms of our telepsychology guidelines, there's no such suggested. Now, those aren't requirements; those are guidelines that guide us. They're aspirational, but from a practice, a sort of a standard of care perspective, I am aware of certainly specific clinical circumstances where I'd want to have an in-person assessment. If there were, certain interventions we were doing or assessments that would really benefit from that, it may be a question of what your comfort is, what the patient is, but from a strictly data-driven perspective, that really gets down to that is much more a question of reimbursement and who's paying than anything that I'm aware of from a standard of care perspective beyond kind of the idiosyncratic service and the preferences of the patient and provider. All right,
thank
well, we're about
you.
down to our time here. We have our helpful list of acronyms, which people can find on their handouts. And because this is telehealth, there are many, many of them. But we wanted to take a moment and just talk about the topics we talked about today, inclusive of fitness to practice telepsychology, how to find those jurisdictionally specific laws and things to think about when marketing your telehealth practice. And then we answered a bunch of other questions as well as they came up or themes that sort of emerged. This is the telehealth community chat, after all, and we get to chatting. You can reach us if you have an additional question at telehealthcommunity@trustinsurance.com. I always like to mention that. And please know that Margo and I read each of the questions and comments, and we really try to do our best. We didn't get a chance to address it today, to address it in a future chat.